Okay, so the topic I chose to focus my project on was HIV and kind of world HIV data. I had some general goals going into this project. The first one being just to explore global trends in the number of people living with HIV. Obviously, I had heard about the HIV and AIDS epidemic that happened in the 80s and 90s, but I didn't really know much about where those numbers were today, so I was curious to kind of look into that and research that. That's why I chose this topic. My other goals going into the project were more just based around learning and improving my knowledge of Google Sheets, so things like improving my ability to read data on Google Sheets and Excel, improving my spreadsheets working knowledge, so like actually how to use the spreadsheet, and then also just learning more about a topic I'm a little bit unfamiliar with. Okay, so next I'll get into the sources that I used for my data. The first one being my main data source, which was from the World Health Organization. It was the estimated number of people, all ages, living with HIV. This is kind of the main data set that I used and was working with. And then the second data set that I used was from the World Bank, and it was just like the GDP of all the countries, or most of the countries in the world. Quickly, before I get into some of my findings and visualizations that I made, these are some ways that I used the sheets when I was looking at my data. Some of the functions that I used, I found the unique function. That was one that I used a lot. The XLOOKUP function was really helpful, and all of these functions I had never used before in Sheets, so I found them all to be very helpful kind of shortcuts. And then other ways that I used the Sheets were just making different charts, learning how to edit the charts, and then sorting my data differently to see different trends, different maximums, minimums, things like that. Okay, so now on to the visualizations that I made. This first one is just a map of all the countries where there was missing data. So, a lot of North America, Russia, China, some Eastern European states. These are just countries that didn't have, I'm sure they have data somewhere, but on the data set that I was using, it was blank for them. So take that into consideration when looking at other visualizations and findings and conclusions. So this first map is using all the data. It's just showing where the most people living with HIV are. So you can see it's really high in South Africa, and then the rest of the world is kind of a similar color. So in this map, I took out South Africa from the equation, and you can see there's a little bit more variation. I'm sure I could have gone farther, taken out India, and you would have been able to see even more variation. But even the variation between these two, you can still start to see a little more variation. This next visualization, I didn't make in Sheets, I just made it on my slideshow, and it doesn't really, it's kind of just to show the numbers. The bars don't really represent anything, so it's a little misconceiving. The block in the upper left hand just shows 3 countries with the highest estimated number of people living with HIV. You can see that South Africa, India, Mozambique, and that's kind of obvious from if you go back to the maps, the hotspot in South Africa, and then taking South Africa out, you can see Mozambique and India are the next 2, highest places. In the top right hand is the 3 countries with the highest percentage of people living with HIV, which is something that I used my sheets to look at, because obviously, just because a country has the highest number of people living with HIV doesn't mean that they have the highest percentage of people living with HIV, because you have to take in consideration the population of that country. And we can see that here when it switches to Eswatini, which has about 19%, and then Botswana, and then South Africa is still on that list, but it's not the first. And India and Mozambique don't even show up on that list. These bottom two are the opposite. They're the lowest. So the 3 countries with the lowest estimated number of people living with HIV. This one's kind of backwards because the shortest one's on the bottom. So the Maldives, Comoros, and then Iceland. And then again, we see differing with the 3 countries with the lowest percentage being Syria, Jordan, and Bangladesh. So for these next 3 visualizations, I used the top 3 countries with the highest percentage of people living with HIV, and I just put them on a little line graph going from the year 2000 to the year 2022. And I thought it was interesting when I charted these, they all had a kind of similar line, South Africa being a little more dramatic, but they all kind of started low and then peaked around between 2010 and 2015. And I wondered why this was. I didn't do too much research on it, but I kind of hypothesized that now we have more medication for people living with HIV that, expands their life and whatnot. So I looked up when the drug PrEP came out, and PrEP came out in 2012, which is right around the time that we see these numbers kind of stay high. Now we can see more people living with HIV because people can live with HIV without getting very sick and dying. So obviously we're going to see those numbers kind of go up and then stay the same. It is also interesting that they none of the numbers seem to be still going up. Obviously this is from 2022 and it kind of just cuts off, but it's just interesting to see that, that line doesn't seem to continue to be going up. It's either stagnant or going down a little bit. Yeah, it's just interesting that you can see in all these charts kind of around the time that PrEP came out, you see that stop rising, peak, but stay the same. Okay, and then this last chart is when I started using the GDP data, and I thought that there would be a bigger correlation between a country's GDP and the rate of HIV. They're the amount of people living with HIV. But it turns out that there's not really a significant correlation. And later on, I have some slides of a couple research papers that I took a quick look at that say the same thing, that it's GDP and people living with HIV, there's not really a huge correlation. I didn't make this graph, but I wanted to include this because I thought it kind of related to these line graphs that I made, because you can see that the number of people living with HIV is going up, but the deaths and the new infections are kind of staying the same, maybe going down a little bit. And I thought that further kind of showed how drugs like PrEP are kind of, even though you're seeing the people living with HIV going up, I think that's probably because, we have these drugs now where if you get HIV, AIDS, you're not going to die, you're going to see the numbers go up because these people are living longer. Okay, so next, some outside sources that I read while doing this project. The first one was before I really started delving into the data. I just wanted to see what was out there with HIV, how it affects people differently, especially since I was looking at world HIV data. So this was an article that I read that kind of just talked about the disparities of people living with HIV based on their gender, class, sexual orientation. I think that this article maybe would be a little more relevant if I had focused on a singular country and then looked at those disparities within that country, just a little smaller focus. Then the next two papers that I looked at, I mentioned before, and these were just studies that kind of, I don't know if proved is the right word, but corroborated what I found when I was comparing GDP with people living with HIV. Okay, so then for my reading connections. So for my first reading connection, I mostly had a lot of questions because this data set is so big that it's hard to, to get all that nitty-gritty information. So I had a lot of questions like, where's this data being collected from? Where are they getting it from? Hospitals? Are they getting it from, like census survey type things? I just had a lot of questions like that I never really got answered, but that I think are relevant to, I think are important to think about, because they can change the way that we see this data. Then my second reading connection is kind of similar to my first reading connection, but maybe a little more focused. So how do these geopolitical issues, where people are located, their situation, how does that affect how the numbers are counted? Because, if they're sending out a survey asking about sexual orientation, asking about, if you have HIV in a country where it's gay sex is illegal or it's homosexuality is illegal or criminalized, people aren't necessarily just going to give that information to their government or whoever's doing the survey away. So how does that affect what data is collected? And then also, just to mention, a lot of places that don't have good healthcare systems, don't have a lot of resources, don't have a lot of money within their healthcare systems and hospitals, what are the odds that the people that go to those hospitals for medication for their HIV or to get checked for HIV or whatever, what are the odds that those people are getting counted when they already don't really have a lot of resources or accessibility? Okay, so then on to my next steps. I think there was definitely a lot of things that I wish I could have explored that I wasn't able to. I would like to be able to compare HIV-related deaths compared to the people living with HIV, because I think that would further corroborate my theory of, since drugs like PrEP came out, it seems like, there are more people living with HIV, but I think maybe the deaths have gone down. I don't know. I haven't done the research, but I think that would be interesting to look at. I would like to look at how HIV affects women and children in the world, or the number of women and children living with HIV, where that's different in different countries. Kind of going back to my reading connection, laws based around LGBTQ plus people, if that affects the number of people living with HIV, or if that affects the number of people counted living with HIV. And then just more country data, going back to the map that I showed previously. A lot of countries were kind of excluded in the data set that I was looking at. So I would like to look at the data for those countries as well. And that's my project.